Hi. I want to go back to the point when Minister Shephard and Dr. Russell had stated that the findings of the investigation are scientifically reliable. We have some concerns with that. And it is that in order to have reliable results, the information that you're gathering needs to be very rigorous and it needs to be accurate. So this question is going to be twofold. We have patients in this cluster that have memory issues, cognitive issues, and the initial epidemiological report starting this whole investigation was information that was given by these individuals based on memory. And so right there, we have a concern for reliability in that case. So we're talking, if something is going to be reliable, it needs to be at the very base, completely making sure that there's no room for error here. So when we're talking cognitive decline and cognitive issues, there's a large margin of error that can take place. So one, taking information and using that as 100% reliable can cause issues moving forward for any result that you're going to find or outcome of any investigation. Secondly, were there any case controls taking place that were going to be showing one group that does not have these symptoms versus another in order to determine 100% that there is no environmental cause to these really atypical presentation of symptoms? And next is the idea that in order to have an ethical standard practice of care, as we understand it, a medical diagnosis, and in this case, removing a diagnosis, which is one and the same, is that, it's established by a questionnaire of the patient and confirmed with a physician examination and further investigations. And that's the standard ethical practice for any physician or neurologist. So, we want to understand how that the panel of neurologists could come to this conclusion that there's unknown conditions without following this standard ethical practice by not including family physicians, by not including Dr. Marrero in this discussion to give his understanding of the clinical findings that you have in our files, and as well as not meeting with the patients face to face. There is an ethical standard here that we're having a concern with.
Thank you for your question, Stacy.
It's Dr. Russell here. I can't get my camera on because my computer just froze. The epidemiological survey is not a case control type study, so that is why that did not occur. And with respect to interviewing the patients, I do concur with you that if people have memory problems, that's a challenge, and that's why in these situations, it's not just the patient that's interviewed; it would be their proxy, to avoid that problem that you're raising, which is quite relevant. So, and the other thing is that we're not saying that people aren't sick. We're saying that they don't belong to a specific cluster and have the same diagnosis. And so, in terms of the clinical files that we had access to, all of that information was accessible to us and contributed to the work that the Neurological Oversight Committee used. And so when it comes to, again, identifying what is reliable, there was, again, the clinical review of the neurologist along with the epidemiological review. And at the end of the day, again, we're not saying that people aren't sick. We're actually recommending that people seek a second opinion. We're actually recommending that people continue to be supported in the mind clinic to make sure that an accurate diagnosis is found for the symptoms that they're experiencing. And that has been the case for several of the cases in this review. So, so again, we're very concerned that everybody has access to the care they need and the support they need and the treatment they need and the diagnosis that needs to be assigned to them based on their individual symptoms.
Okay.
Thank you. I'm going to turn
just a follow-up question to that, please. So would we then understand that any recommendations that would be given from the Mind Clinic or any family physician, any physician or specialist overseeing the file will be followed by Public Health and Department of Health?
Public health is not involved directly in these investigations unless it's through the process that we're establishing moving forward, that we've made the recommendation for with Public Health Agency of Canada. So I am aware that there is one new case that has just gone through that process, which we will be reviewing. But that is the how Public Health will be participating, is through that process that we're working with Public Health Agency of Canada moving forward, because it was brought to my attention that there are other cases, perhaps as many as 100, which we're not aware of because they haven't gone through that process. So if that process is followed, we will be investigating and be participating in those ones, but it has to go through that process.
Thank you. So before I ask my question, I just want to indicate and acknowledge that this is a very emotional time for all of us. There are, at least 9 people who are deceased, and the rest of either us or our loved ones are dying. And this makes it very difficult for us not to come across angry or not to come across as ungrateful for what has been done. And we do acknowledge that there has been some things that have been done, but there is proof that Minister Shephard's office indicated to the Public Health Agency of Canada to stand down. They were working together collaboratively at the beginning. So I just want some acknowledgement that the government of New Brunswick changed their relationship with the Public Health Agency of Canada in the spring of 2021. So that's my first part, is an acknowledgement. The question that I have is, it is reported that there are over a dozen households that have more than one person in the household that is suffering from an unknown neurological condition. And don't get it twisted, it is unknown at this time. How can you say that there is no evidence of a cluster when there are over a dozen households, including some people in this room, who there's more than one person in the household who are suffering, and there are upwards of 150 people who have not been studied? That's a lot of people for a small province like ours. And I say ours because I'm from New Brunswick as well. So I would like that acknowledgement as to why you told them to stand down. And I would like to know why you still don't think there's a cluster. Thank you.
So in terms of just coming back to who leads an investigation, there was definitely a conversation around who needed to lead the investigation. And if there had been cases found in other provinces, we would have turned over the lead for the investigation over to Public Health Agency of Canada, because that's standard practice. But where there were no cases outside of New Brunswick, that is why the lead had to be here in New Brunswick. But at no time did we tell Public Health Agency of Canada to stand down. We worked with them throughout this investigation. We had a multidisciplinary team as well that finished their work. And if they had found something along with the epidemiological survey and clinical survey, then again, we would have taken into account all of those findings. But that's not really, again, what happened. So we really, again, followed the process. And again, we're not saying that people are not sick. We're just not saying that they're related to a common cause. It is very important that anybody who has, as Dr. Bogdan mentioned, that if you have neurocognitive symptoms, that it's very important for you to get assessed, get treated, get support, and get a proper diagnosis, whether that takes 1, 2, or 3 opinions. That's very important. The only conclusion we're really bringing forth today is the fact that all of these cases are not related to a common cause, but they all still need to be followed up. They all still need to be supported. They all still need to be diagnosed and treated correctly. And again, the other people that you're speaking about, very happy to look at all of those cases, but they have to follow the correct process, and they have to have a referral into this process by their referral their physician.
Steve, a quick follow-up. Minister?
If I could just, if I could
Yes.
just inject that, you know, I do just want to acknowledge that I know this is very emotional for your families. It is, it's very difficult to be in the position that you're in. And I know that there isn't much comfort I can give to you. You know, we have never not accepted Public Health Canada's involvement. We followed a process, what we believe to be the proper process. And we certainly will have our reports out there, and know that they are subject to being judged.
Mr. Ellis, a quick follow-up, and then I'm going to go to Stacy.
Yes, thank you. So my question was not answered regarding why you're not acknowledging that there are more than one person suffering in at least 12 households. And also my follow-up question is regarding other provinces. Dr. Marrero has made public health and the minister's office aware that there are other cases presenting to the clinic that are from other provinces. So can you please answer my first question? Thank you. And answer my follow-up. Thank you.
So, Steve, I am not a clinician. And so it will be up to clinicians to determine what households are involved in needing, you know, neurodegenerative diagnoses. I cannot determine that. That I am a minister of health. I am not a clinical doctor. And so that must be put to the professionals who are in our systems to do that. So I can acknowledge that you may know of 12 households that are suffering. I do not have any clinical exposure to that. So, and I guess all I can say is that we continue to be invested in the Mind Clinic, and we will support them.
I'm going to now go to Stacy.
Thank you. I'd first like a clarification on something that Dr. Russell had said, please, and then I have a follow-up question to that. So, Dr. Russell, you had said that there's no scientific investigation that warranted concern for any potential environmental cause of these conditions. Can you tell me tell us what scientific evidence that is?
So in terms of the multidisciplinary team that we had working with us, as well as the epidemiological study, as well as the clinical review, all of those things combined did not point to a single source that would have directed us to do further investigation in that environmental piece. So I hear what you're saying, and I wish there was more I could offer you other than that we had all of these different people working with us to make sure that there wasn't a link, that if we could find a link between all of them that was common in source, then we would further those investigations to look into those mental issues.
I hear you on that, and thank you for your answer. You know, we've established already in this discussion that the epidemiological report cannot be, you know, scientifically sound and reliable if patients who have cognitive issues are responding to the questionnaires that potentially some of their family members would not have answers to, nor potentially had the possibility to speak on their behalf in some cases that we're aware of. As well as the clinical review of the files, what experience does a neurological team have in determining if there is an environmental cause taking place here? And how can that be determined by clinical files?
Je peux juste commenter, le comité de surveillance n'avait pas ce mandat-là. Le comité de surveillance avait comme mandat de voir si les cas étaient liés ensemble. C'était pas le mandat d'aller voir autre, et c'était de voir avec les symptômes si on pouvait trouver quelque chose de commun et si les patients étaient liés ensemble. C'était vraiment le mandat du comité.
Thank you for that very much, Dr. Banville. And I guess that brings me to the concern that we were saying that this information, how can it be reliable based on the clinical reviews as well? We need scientific investigation.
I'll just come back to the interviewing piece. Each file, they spent 4 hours each file in terms of whether it was the patient themselves or whether it was a representative or proxy or family member. So in terms of the rigor that was used to interview the patient, that was the process followed. And then coming back to the information around around the environmental concerns. So we definitely, when we took into account all the different variables and possibilities and potential issues, we had subject matter experts that we had work in our multidisciplinary team from Department of Agriculture, Aquaculture and Fisheries, Department of Environment. We had natural resources involved. We had Canadian Food Inspection Agency. We had the Canadian Field Epidemiology Program involved. We had the Center for Foodborne, Environmental and Zoonotic Infectious Diseases. We had the Outbreak Management Division. We had the Policy Integration and Zoonosis Division, CJDSS, the National Microbiology Lab, and in additional consultation with the British Columbia Centre for Disease Control, we had the Canadian Institutes for Health Research working with us, as well as the Canadian Wildlife Corporation, Wildlife Health Corporation, and the National Research Council, as well as the University of British Columbia. So all of the exposures, all of the potential environmental exposures were considered as a possible source, including blue-green algae. So, however, the problem was that there wasn't enough evidence to consider any one source over another until the full epidemiological investigation could take place. And in the meantime, sample collections for blue-green algae, so that testing could place at a later date if needed, was in that process as well. But it's worth noting that in the summer of 2021, we didn't actually have the weather conditions conducive to the production of blue-green algae, which is funny because we've had so much blue-green algae leading up to that year, but that particular year there wasn't. So we didn't have the blooms, and so therefore we couldn't take samples. So clean and safe drinking water is a basic human right. And we do work with all the municipalities in the province. So municipal, provincial, and national entities coordinate resources to constantly monitor water quality in our watersheds and the drinking supply of all residents of New Brunswick. And the local governments work and collaborate with the Department of Health and the Department of Environment and local government to ensure we are proactive and that we adopt a preventative approach to protecting the drinking water supplies and water quality that's delivered to residents of the province, as well as meet or exceed the standards related to recreational drinking water, municipal bodies of water rather. And so the Department of Environment and Local Government provides surveillance for harmful algae blooms that may be present in freshwater bodies in the province. And Fisheries and Oceans Canada, the DFO is responsible for safeguarding Canadian waters and managing Canada's fisheries and ocean resources, including a similar surveillance and surveillance of shellfish and saltwater bodies through the Canadian Shellfish Sanitation Program. So when algal blooms are reported in the province, and samples are collected and analyzed to determine the type of concentration of algae present, including blue-green algae advisories are then issued accordingly. And during 2021, Department of Environment and Local Government agreed to collect additional samples from water bodies with blue-green algae blooms for further analysis. However, as I mentioned, the conditions that produce those algal blooms were not present in that year, and that therefore no algal blooms were observed during the warmer summer months, and additional sampling did not occur. But Public Health maintains their blue-green algae page website, which is present in past advisories. Once an area has a designated advisory, it actually remains in place. It doesn't change. So once a place has algal blooms that have been witnessed and observed, then they remain in place because that means that they can return.